I am Dr.N.Vijayalakshmi, MD General Medicine, Physician, Palma Clinic and Nursing Home. Today we will talk about a fever most commonly existing in the city following the heavy rainfall because it is caused by a mosquito called dengue viral fever. Dengue viral fever is a arbor virus fever. It is transmitted by mosquito bite. These mosquitoes are those who are found on the walls, creeping on the walls in the daytime, unlike malaria. The mosquito species will be Aedes aegypti and Aedes albopicus. Only these two are causative for the viral fever. This fever has an incubation period. Incubation period means the time it enters the body when it gives the symptoms lasts for about 3 to 10 days. The typical classical dengue fever complaints of patients will complain severe body pain, high spiking fever, chills, severe exhaustion. Sometimes they may complain of severe intractable headache, vomiting, and at times rashes will be found on the body. These are the typical features of dengue viral fever. When it becomes severe, they go for other complications which is called dengue hemorrhagic fever, where the patient develops multi-system, multi-organ symptoms like bleeding from the nose, epistaxis, bleeding from the stomach, hematemesis, bleeding in the motion, melena. That is a severe type of dengue hemorrhagic viral fever. Why these things occur in dengue viral fever is this virus attacks the platelets in the circulating system. Platelets are required for clotting of blood. So, when these platelets fall, when the clotting fails, these symptoms occur. So, how do you diagnose this fever? Once the patient develops the fever, the clinical features will be, patient will be very toxic, dehydrated, rashes over the body and sick looking. Clinically, how do you diagnose will be, first you have to do a simple blood test, do the platelet count. Normal count will be 1.5 to 2 lakhs and above. When the count falls below 1 lakh, you start suspecting this fever. The blood test should be done 3rd or 4th day of the fever. First day, second day it may not be confirmatory. So, you confirm it is dengue viral fever 3rd, 4th day. Once you find the fall in the platelet count, then you have to do the dengue antibody test called IgM, IgG, NS1, which will confirm patient is having primary dengue fever or secondary dengue fever or recovering from the dengue fever. This is the main criterion, doing a platelet count, dengue antibodies and total count. Once you diagnose and confirm it is dengue fever, then all systems to be affected by the dengue fever must be evaluated so that you don't miss anything in the patient. So, next is you have to do an X-ray chest to rule out any protein water leakage into the lungs in the pleural cavity, pleural effusion you have to look for. Next you have to do abdomen screening to rule out enlargement of liver, enlargement of spleen, fluid in the abdomen ascites. Then how do you treat the patient? Even before you diagnose with platelet count with dengue antibodies, what the patient requires will be severe heavy hydration. Hydration itself will relieve the patient of its symptoms by 50%. So, if they are able to tolerate orally, they can be given oral fluids from 2 to 3 liters per day, including fruit juices, buttermilk, all other items. If patient is too toxic, sick, dehydrated, then you advise them to hospitalize. In hospital, fluids, IV fluids can be rushed depending on the body weight of the patient. And main thing you have to look for will be the hematocrit rise is more than 40 to 50% to correct dehydration with clear fluids at the rate of 10 to 20 ml per kilogram body weight per hour. The confirmatory sign will be daily you have to check the platelet, daily you have to check the hematocrit, because the platelet fall may be significant, more than 50,000 or fall even below 5,000 can occur. So, what are the complications to be anticipated must be explained to the patient, and the need for hospitalization and observation of hematocrit and platelet. The fall in the hematocrit and increase in the platelet and patient's hydration are good signs that they are recovering. Sometimes the platelet fall may be beyond the limit, then only hydration does not help. You may have to replace the platelets 2 or 3 as per the count. Sometimes may have to give plasma for the clotting factors to be replaced in the body. In that case, the patient ideal will be to be admitted and observed. If the platelets not timely given, if the fluids are not given in time, patient may go for shock and multi-organ failure. Patient may start bleeding from the nose, bleeding into the stomach, bleeding in the stools. They may go for peripheral circulatory failure, shock and arrest. So, this has to be in detail to the patient. So, the dengue hemorrhagic fever, when the count is fall is too much, in that case then you may have to replace with blood. Usually in that case the hematocrit will be low, then you may have to replace with fresh PRBC, plasma, platelets and fluid hydration. With all this, patient's spiking temperature can be controlled with oral paracetamol, IV paracetamol infusion, ice sponging and frequent monitoring of BP, temperature, platelet and hematocrit. Since it is viral, there is no place for antibiotics, but supposing patient has associated respiratory infection, cough, urinary infection, cystitis, enteritis, then the need for suitable antibiotics along with this supports may be required. As such, for this dengue viral fever, no vaccine is available. So, ideal will be prevention, which is better than going for cure. How do you prevent? Prevention will be no waterlogging anywhere, waterlogging in the windowsill, waterlogging in the ground, then strewn garbages, open plastic tins, bottles, tires where small quantities of water collect. These are the areas where the mosquitoes breed. So, you have to be sure that garbage is cleaned, there are no open bottles, tire tubes collecting water should be cleared, and those areas where water stagnation is there, ideal is to spray insect repellents, pesticides so that the mosquitoes do not breed. And also, once a patient with dengue fever is admitted or at home, the spread of this to the another person will be prevented by using mosquito nets. Since no vaccine is available, prevention will be better than cure, so that dengue can be prevented from spreading in the community.